Assalamu alaikum and good afternoon to all the participants. It is very heartening that you are attending our policy dialogue session, and we conduct exactly for 1 hour. Today, I'm honored to introduce you with Dr. Rozmeen Shivji, who is working as an assistant dean in Rush University College of Nursing. She is board certified acute care nurse practitioner at the University of Chicago Medical Center. Her extensive experience span across various clinical environments, including medical intensive care, lung transplant, where she has earned recognition as a future leader. Her research interests are rapid response team, rejection in lung transplant, and advanced practitioners. She has been working with Dr. Rubina Barolia, professor at the Aga Khan University, to initiate a very important role of advanced practitioners. We invited both of them to discuss and to let us know their story of journey of advanced practitioners. I welcome them, both of them, and may I request Dr. Rozmeen Shivji to start her presentation. Dr. Rozmeen Shivji will give her presentation first, and then we will move with the question and answer session. Thank you. Please send your questions on outreach email. Thank you so much. Dr. Rozmeen, over to you.
Fajan, for the fine introduction. I appreciate the opportunity to present the work that we have done at Sonam, Karachi, Pakistan. So thank you so much. Lovely introduction. I appreciate it. I'm glad to see Dr. Rafat has a crystal ball where she can see me being the assistant dean at Rush. That's definitely my aspiration, inshallah, one day. Currently, I do work as an assistant professor at Acute Gero Adult Nurse Practitioner Program, which is a doctorate prepared program at Rush University, and as a lung transplant nurse practitioner at the University of Chicago Medical Center. The objectives for today's presentations are that at the end of the presentation, the viewers will be able to state my journey from becoming an RN to doctorate prepared nurse practitioner, describe the role and responsibilities of an acute care nurse practitioner, discuss the journey of APN role development at AKU-SONAM, Karachi, Pakistan, and explore the existing limitations and the potential limitations to accomplish the goal. I just want to let you know I will be repeatedly using AKU-SONAM or SONAM, and I'm referring to SONAM, Karachi, Pakistan. So my journey started at SONAM, getting the diploma in 94 and then BSN degree in nursing in 1999. Then I migrated to United States of America, where at UIC, University of Illinois, Chicago, I first did my master's specializing in acute care nurse practitioner program. And then after doing some practice over the years, then I went to accomplish the terminal degree, which is Doctorate of Nursing Practice, again from UIC. My clinical journey started at ER at AKU Karachi, Pakistan. When I moved to United States, I worked as a nurse in the ICU, medical ICU at St. Joseph. And after completing my master's program and specializing in acute care, I moved to University of Chicago, and my first job as an NP or nurse practitioner was in the medical ICU service. I was the first one who actually established the service at medical ICU. Then I also explored neuro ICU or neuro IR, leukemia services, and I also established leukemia services at University of Chicago. And finally, worked in lung transplant, and I continue to work in that service, along with being the assistant professor at Adult Acute Care Nurse Practitioner Program. The University of Chicago is considered one of the top university hospitals in United States, as well as Rush is considered among the first or the number one online program in nursing in United States, and it has a lot of other significant programs ranking very high in United States. So before we move on talking about how and why we develop APN, we are trying to develop APN program at SONAM, it's very important to understand who APNs are. So according to International Council of Nursing, an advanced practice nurse is a journalist or specialized nurse who has acquired through additional graduate education, minimum master's degree, the expert knowledge, complex decision-making skills, and clinical competencies for advanced nursing practice, the characteristics of which are shaped by the context in which they are credentialed to practice. Now, there are 4 types of APNs or advanced practice nurses. However, we're going to only focus on nurse practitioners today. NPs are nurses who, after additional education, again, requiring minimum of master's level degree, are autonomous clinicians. They are educated to diagnose and treat conditions based on evidence-informed guidelines that include nursing practice principles. The level of practice autonomy and accountability is determined by the context of the country or settings in which the nurse practitioner practices. So basically, important thing here to know is that nurse practitioners are autonomous clinicians who diagnose and treat medical condition, keeping nursing principles in line, and their practice could vary by the institution they work and the country they work. Now, nurse practitioners in North America needs to have credentials. And when I say North America, I'm referring to United States of America. These credentials are determined or set by the states in which nurse practitioners work. And privileges are the actions or interventions or clinical skills that nurse practitioner can use or practice at a particular institutions. So for example, I live in Illinois, so all the nurse practitioners working in Illinois could be credentialed equally or similarly. However, our practice could still differ based on the organizations or institutions or the clinics we work. So that's the major difference between credentialing and privileges. You can refer to credentialing and privileges of APN and who APNs are in more detail at outreach videos as shown on the screen. Now let's talk about the historical perspective of how nurse practitioner role was developed. So in 1965, Dr. Loretta Ford, as you can see on the screen, and Dr. Henry Silver, who was a physician by practice, they developed the first nurse practitioner program at University of Colorado in America. The purpose was to address 3 major issues that were happening at that time, and that were physician shortage, which led to the concern of quality of patient care and access to healthcare. That sounds pretty similar, right? We are facing that problem still today. So Dr. Loretta Ford, we celebrated 50 years and she was present there in person and I took the picture. I know the picture is a little blurry with her, but I promise you this is not photoshopped. So the role of nurse practitioner did not emerge right away or called nurse practitioner in the first year or the first day when it was founded in United States. It evolved over the years. In 2022, we have about 355,000 nurse practitioners in United States. Now here, this slide shows important evolution of nurse practitioner role globally. Although it is a little old slide or the data, however, I found this important for us to know because as you can see, in different countries or continents, the role of nurse practitioner was established at different times. Their role titles and the regulatory measures are again different by the country or the continent. as I spoke earlier about the role of the nurse practitioner is defined by the institutions and country they work. However, one common thing here to notice is they all require master's degree. And in last decade or so, 10 or 8 years, the role of nurse practitioner is evolving in Europe, especially Netherlands and Middle East. And it's a very rapid growth, which is a very good sign. So let's talk about who nurse practitioners are and how what they perform, taking my example. I am an acute care nurse practitioner. My primary responsibility or practice is in inpatient area, but we also practice in outpatient settings as well. So as a nurse practitioner in the lung transplant service, I diagnose medical problems based on the evidence and other clinical data and radiographic data available to me. Then I propose and implement the treatment plan based on patient's condition. I do conduct procedures. I have done paracentesis, thoracentesis, lumbar punctures, A-line insertions, bone marrow biopsies, and etc. I monitor follow-ups of the patients. I evaluate program outcomes. I ensure multidisciplinary rounds and their engagement, and I'm the primary person responsible for that. I educate patient, family, nurses, and residents, and I orient and mentor newly hired nurse practitioners. Additionally, I do conduct some quality improvement projects. One of the projects that I led was A-line insertion billing process. And within 1 year of implementing that process, we were able to earn or gain $100,000 in 1 year. I didn't get to see a single dime of that. That's a whole different story. But there are significant QI projects that nurse practitioners clinically run. As I mentioned, I am an assistant professor at College of Nursing, Rush College of Nursing in Adult Acute Care Nurse Practitioner program. Our program ranked number 4 in the country. I teach APN students, nurse practitioner in particular. I advise students for the DNP projects, which are usually QI projects. I mentor APN students with their preceptors on their clinical rotations. I create, revise, and update courses, and I mentor students with their scholarly work. One of my students and I published one important paper of spontaneous awakening and breathing trial last year, and it was well received. And as a nurse leader, like any nurse leader around the world will do, I do research, I do scholarly projects, I disseminate my work by presenting at the conferences. I am a panelist like I am today. I do moderate conferences as well, abstract review, I'm a critical care educator nationally and internationally. I direct and am the faculty of fundamental of Critical Care Support Program, which is a SCCM or Society of Critical Care Medicine program, and I do professional collaboration. So now let's focus on about why we need to establish APN program in Pakistan. Why should Pakistan support this paradigm shift, right? So 38 million people died in 2001 from non-communicable diseases, accounting for 68% of global deaths. And 28 million occurred in low socioeconomic and middle socioeconomic countries, and Pakistan falls under them. The common non-communicable diseases were cardiovascular diseases, cancer, COPD, and diabetes. It is expected that by 2025, 7 trillion USD dollars, United States dollar, will be lost for low and middle income countries managing these diseases. WHO says that 62% of deaths in Pakistan occur due to non-communicable diseases and injuries. So this slide basically shows the burden of non-communicable diseases in Pakistan, which is a huge burden. And according to 2019 data, Pakistan has 1 physician per 1,000 people. So physician to people ratio in Pakistan is really, really low. There are countries ahead of us, but there are countries behind us, but our access to healthcare professional is very limited. The other alarming facts are that in North America, it consumes 52% of world's health finances and 37% of world's health worker and 10% of the disease burden globally. However, Africa consumes 3% of world's health worker and has 24% of global disease burden. Whereas in Southeast Asia, where Pakistan falls, it consumes only 1% of world's health finances and has a huge burden of diseases that we just spoke about. And it only consumes 12% of world's health worker and has 29% of global disease burden. So here you can see the disparity of allocation of resources, right? So what do we do? WHO has provided 6 steps to address the problem. And among one is human resource development. And that's where APN role development or nurse practitioner role development comes. So Dr. Sulaiman Hassan, a cardiothoracic surgeon, and Dr. Babar Hassan, a peds cardiologist, they both initiated a program, pilot program in January 2015, where they recruited 5 critical care nurses, and they recruited or identified physician mentors who were assigned to these nurses. These nurses got some educational training or sessions at the medical college, and basically they got on-job training to become clinicians. And within a year or so, they were able to achieve some impactful outcomes like reducing length of stay, surgical site infection, reducing readmission rates, and increasing patient satisfaction. The outcomes were so impactful that they wanted to expand that clinician role throughout AKU hospitals. At that time, I was recruited on a TKN, Time and Knowledge Nazrana assignment, to come and evaluate this pilot project. So in 2016, I came and visited AKU Karachi, Pakistan, to do SWOT analysis and to see how we can sustain this program. The program had very good strengths, undoubtedly. However, there were some limitations, which definitely created some opportunities as well. But the major limitations was that the project, which was a nursing project, was housed with physicians. There was a disconnect with the School of Nursing that actually gave the opportunity to collaborate strongly with School of Nursing and then to sustain the program. So at that time, Dr. Sulaiman Hassan and myself had meetings with SONAM faculty, including Dr. Raisa Gul and Dr. Rubina Barolia. So with that TKN project, I was able to bring the major stakeholders, AKUH and SONAM, together. At that time, SONAM offered masters in nursing practice, but the focus was on education and leadership. So there was a huge opportunity to create a clinical track program, and which we did. So in 2016, the new MSN track clinical program was conceptualized, and it was started in 2017. So I was able to develop the curriculum of that first clinical track. And then since it was going to start specifically to cardiothoracic, so I was able to develop competencies accordingly and provided a parent document. And these competencies and curriculum was based on ICN, International Council for Nursing, and National Organization of Nurse Practitioner Faculty, or NOF, which is based in USA. And by 2001, there were about 52 students who graduated from the clinical track program. Now, I, during that time, was able to visit Pakistan and AKU Karachi, Pakistan, and presented at various conferences the role and responsibility and the opportunities that Pakistan and AKU have to open or establish or found this APN program. So this is the first basic clinical track program that was established. But after that, Dr. Rubina Barolia and her team has updated it as the time and the context have improved or gotten updated. So this program itself had some challenges. And of course, we have support from many important bodies and stakeholders. So let's talk about some of the challenges that we have been facing. In 2019, Dr. Rubina and I were able to do lobbying with physicians across the country. And we were making this lobby stronger by the day. But unfortunately, in 2020, we had COVID pandemic, and we all know how that led to multiple undesirable consequences. And then Pakistan saw one of the worst flooding or disaster. It has had multiple geopolitical and economical disasters as well. And we had faced some resistance from our physician colleagues, and very reasonably. It's a new role in the country. So physicians are concerned, and the common concerns that we have received from physician colleagues are that they don't think nurse practitioners are physicians or doctors, which they are very true, absolutely correct. Nurse practitioners are, or APNs are not doctors. They are very different entity. They also worry that nurse practitioners are going to take their job. And we have assured them it's a new role which will work parallelly with them, but there is not an idea of taking over doctor's role. And again, there is a concern about the quality of education and training, which is, of course, a concern, very accurate concern. But for that, we have been addressing with quality improvement of the nursing programs. The other concerns that we had were from nursing services. They were concerned about the quality of the care and role delegation. Legislative body in Pakistan, they had some difficulty accepting the role, but slowly but surely that has been changing. And the AKU leadership also had some concern about financial support, its sustainability, and role acceptance from physicians and legislators, which are, of course, very reasonable and accurate concerns. Now, who are our stakeholders who will help us overcome those challenges? So if you ask me, in my opinion, everyone who lives in Pakistan or anyone who is interested in Pakistan growth is the stakeholder, be it in the government, physicians' body, organizations, media, nurses themselves, and our community with our patients and family. They all need to play their role to establish a nurse practitioner or advanced practice nurse role in Pakistan to bring about changes in healthcare in Pakistan, which is much needed. So despite all these challenges, we have been able to, and when I say we, I mean SONAM, and along with in the leadership of Dr. Rubina Barolia and the Dean, we have been able to accomplish some very important milestones. So SONAM conducted Pakistan's first APN conference in 2020. It was a joint venture with Pakistan and East Africa. And now it's developing opportunities at Aga Khan Hospital, Karachi for MS in clinical track students. So in 2021, at AKU, Karachi, Pakistan, an APN task force was developed under the leadership of CMO Dr. Asim Balgami, and I'm part of that APN task force. And we are working on developing APN clinical residency program, which will be a one-year program offered to nurses graduated from a master's program specializing in the clinical track. That's an important criteria. It has been planned and it's ready to take off. From the marketing flyer to the formative and summative evaluation, everything has been planned and ready to roll. We are working on task force. The task force is working on financial feasibility and sustainability of the program, which is absolutely crucial. And SONAM is partnering with Pakistan Nursing Council. Here, Dr. Rubina Barolia and her team role is crucial. They have been working aggressively with PNC for their approval. And eventually, these are our hopes that one day, and inshallah soon, MS in clinical track will be transitioned into APN degree program at SONAM Karachi. We did a need assessment among nurses in Pakistan about APN role development. The study was conducted by Dr. Rubina Barolia and myself, along with some other team members. And a survey with physician is in the pipeline. And currently, we are working on developing MAU between Aga Khan University School of Nursing and Midwifery, Sonam, Karachi, Pakistan, and Rush College of Nursing. And I'm facilitating that process. There are multiple goals that we're going to achieve through that MAU, but the primary goal is to develop APN role program in Pakistan. And we are currently working on grand accomplishments. This is some wonderful memories that we gathered. The team of Sonam Karachi visited Rush University College of Nursing in November 2023 and met with the dean, Dr. Christine Kennedy. And Dr. Christine Kennedy and rest of the team are interested in developing this MAU. So hopefully, inshallah, soon we'll have that done. And that will lead to or open many opportunities and doors. And at the end, I would like to acknowledge every single person at AKU Karachi, Sonam Karachi, and Rush College of Nursing who has helped accomplish these important goals. Of course, there is a long way ahead of us, but we are still hopeful that we, inshallah, will achieve our goal. These are the references, and I thank you, everyone, for this opportunity, and outreach program in particular, Dr. Rafat and her team for this opportunity to address to you guys. Like I said, we all are in this together. We all have to play our part. This is a dialogue that we are trying to generate through AKU Karachi. It's not a monologue, it's a dialogue. So let's get on it. Thank you. I'm happy to take questions at the end.
Thank you so much, Dr. Rozmeen. And may I request all the participants, if you like to ask us question, please write your question on outreach.sonam@aku.edu. Today, there are many people who have attended this session. I would like to ask this question. You clearly define, and it was very super presentation about whole journey. So you have given us challenges what you and Dr. Rubina faced here in Pakistan, especially in Karachi. What kind of challenges advanced nurse practitioner faced in the past or is still encountering in United States?
Absolutely. So it's interesting that the challenges are, to be very honest, are not much different. Now, the intensity of those challenges over the years have changed. For example, let's talk about one big challenge that we have had faced is some resistance from physician colleague. And again, with due respect, I understand where they come from because it's a new role. Any change is different. So for change to take place or happen or being accepted, it's very important that all the stakeholders are well informed with the purpose. And as the physicians over the time have gotten to know nurse practitioners, they have developed confidence and trust with nurse practitioners. Simultaneously, I also very, very strongly feel that nurse practitioners, and especially the ones that are going to be starting or founding the program, will have huge responsibility to prove themselves. Because it's a new program and the new role, so they have to work their best to gain the knowledge and the skill set to prove themselves. And with that, if they are able to bring changes in patient outcomes or healthcare outcomes, then that will be a fact which cannot be denied. And that's how we are going to be able to change minds. So action always work louder than the words. So I think with that, are able to gain trust from physicians. There have been many publications where nurse practitioner has proven improvement in patient outcomes, comparative study with physicians or residents or fellows, and they have been able to prove that they could take this responsibility. And as the time has gone by, physicians have been able to understand the importance and what they can bring to the table. It has taken 65 years or so, but we have come a long way. So that's one thing. Legislation is similarly, initially, nurses or nurse practitioners did not have full practice authority. Now, over 40-50% of the states have full nurse practitioner authority. That didn't come on the first week or year of being establishing APN role. It came over the time, and still some of the states are struggling to accept that. But these are the major two challenges that we have faced.
That's very important. Legislation is extremely important, and still it's in progress. Dr. Rubina, what are the two important facilitator throughout this journey, and what are the barriers, in your opinion, important two barriers which you, being at the faculty of School of Nursing and Midwifery, encountered to introduce and initiate the role of advanced practitioners?
Thank you, Dr. Rafat. There are definitely many strengths in particularly School of Nursing, because we are the first entity who introduced MSc program in 2000 and in 2001 we have two graduates also, but the program was generic and it was made according to the need of the country. At that time, we required leaders in the country. So more focus is on leader and education. But then later on, we always move forward. So that is a strength of Aga Khan University Sonam, where we can progress. We do not have a static journey. We always go in a progression. So it took almost 15 years to progress up to the level. Then we see that, okay, now the leadership is there, education is there. Now we have to move into specialty. So we from the generic to the specialty, and when we move to the specialty, one of the strength is our board members, our management team, AKU administrator, hospital administrator, they all were in one page that, okay, now we have to move towards the advanced practices. So that was number one strength. Number two strength is our alumni who are working as an APN. So we have seen the progress and we have seen their career opportunities as well. So that was another, that they were all involved. They wanted to involve, and they have seen the fruits. So they want to bring the fruits. So these were the two facilitators. The barrier is actually the national level opportunities, though we are progressing in it, but it is little bit slow because we do not have something, we need to have creation of this career ladder. So national level career structure, where do we fit APN to? And the other is a credentialing, and actually the structure for the credentialing and licensing. So the licensing and credentialing is still a huge a kind of, I would not say the weakness, but a challenge for us that, okay, who will be APN, who will not be APN, and how they will be licensed, how they will be credentialed, and what kind of credentialing they will be getting it. So these two still needs people to know and think and work on it. Thank you.
I have got two very important questions from the participants who are online. The first, how do you foresee the acceptance of APN role by the patients and their families? Pakistan is naturally physician-oriented society, and because we have to pay out of pocket, not insurance or universal health coverage, most of the people, our survey also showed that they're paying out of pocket to the private physician. So how do you foresee the acceptance of APN by patients and their family? And I think this is very, very important question.
So if I may go first, and then maybe Rozmeen could add on it. So, and this actually, the question which you're posing, we have multiple times, we have addressed that. And then we have also discussed that what is our history. So in the history also, we have seen that nursing image is not considered like valuable in context of our patient. But we have seen many examples now, because now nursing profession is progressing, particularly those who are very competent nurses. We have seen in COVID also that how they have worked. So our actually work said something. So that's the reason we have to be like the profession in Pakistan, the struggle for the profession to be uplifted in Pakistan is far more than what we have invested in the world. So it's very carefully drafted curriculum so that people can even see what we are doing. So once they will see what the outcome and the patient satisfaction with the nurse and the other healthcare profession, then it will gradually come up. Definitely this is a challenge, and that's where we want to do the pilot study to see the feasibility of acceptability of APN role. So acceptability of APN role would come once we do 2 years of a pilot program, that where we are in the acceptance and what we need to do for accepting this role in the country.
I thought you have already said that you are struggling with physician. Are you anticipating any struggles with patients and their families?
So I would say any change that you would like to bring, people are going to first show resistance. Some will come on board right away, and others will show some resistance. Finally, they will come on board once they have seen the value of that change. And adding to what Dr. Barolia was just suggesting, here, important thing to know, and what I personally believe is going to be a journey. The acceptance, either by the physicians or by the patients, is going to be a journey. And please let me mind you that resistance could also come from nurses as well. I myself, when I established my role as a nurse practitioner in medical ICU at University of Chicago, the nurses in ICU had some hesitancy and reluctancy accepting us as a nurse practitioners. And it took good 6 months, and I have to prove myself every single day to even fit in my own friend circle. Like nurses, I consider a friend circle. So it took a while. Similarly, with patients and physicians is going to be the similar journey. The important thing is the responsibility on the nurse practitioners and the institutions and the preceptors who will train them. Our actions has to be louder than our words. We can ask group of physicians, nurses, or community that they are good, accept them. We have to prove ourselves that we are good enough to be accepted. So it will be a shared responsibility. And your point of very valid, Dr. Rafat, which you asked about the healthcare system, the insurances in particular, how different it is in Pakistan versus North America. But nurse practitioners, they do bill at a different rate compared to physicians. Right now, that's the trend in United States. So they will see a difference of payment. If you are able to produce quality at a different rate, then you will see an influx. Again, by no means I'm trying to say that nurse practitioners are going to take over the job market for physicians. It's going to be a parallel entity. One of the biggest example will be if we increase the quantity of healthcare providers who can reach to tertiary care all the way to the public sector, then you are increasing the accessibility of the healthcare to the community. Or by community, I mean Pakistan community. So I think one physician can reach 1,000 people. You need more people to reach that, the demographics that I presented earlier. So we have to join hands. And I think we need to work hard to reduce the fears and apprehensions which physician community has and family has or community has. And it will be a slow journey, but it will be a progressive journey.
Let me clarify something. Actually, these are not my questions. These are the questions what participants are writing. The second question is written and we receive from participants is what should be the approach to implement specialty tracks in MSN leading to APN model? Because you have mentioned very well about the APN clinical track. So I think this is a very suitable question. That what will be the approach to implement a specialty track of MSCN leading to APN model?
So if I may, so we already have a clinical track, which is mainly focused on acute care. I'm not saying that it is now focused only on acute care, but mainly focusing on acute care. And based on our learning, we will definitely will going into the specialty track. And for the even for the specialty track, like for example, in MSCN clinical track, we learn advanced pathophysiology, advanced pharmacology, advanced health assessment, generic lab work, and diagnostic procedures. So these will be generic for all the specialty track, whether you are oncology, doing oncology specialty, or maybe ICU or critical care specialty or ER specialty. There are some component will definitely be generic of the clinical care. And then for the clinical component of the specialty, it can be designed by each specialty. Initially, we also wanted to move towards acute care, where we will rotate our APN residents in medical and in surgical and in critical care area, but half way they will choose their specialty between 3 tracks, so 3 areas. So that can be easily doable once we have few people or few nurses who wanted to do the specialty in that area. We cannot have 50 specialty at a time. We can start with one specialty. We'll see the absorption, we'll see the acceptability, feasibility, financial feasibility particularly, and then we can bring also then later on. So if we see last time we presented that from 2025 to 2029 we'll see the acute care, and then after that we'll move to the public health and the other track as well.
Dr. Rozeen, would you like to give your opinion on that?
Yes, thank you. So the reason we have picked acute care is fewfold. Basically, you need to see that when you are doing a pilot project, it has to be in a very confined environment so you can control factors to produce some outcomes. The reason for picking acute care was that acute care specialty could fit into the in-services, various in-services easily compared to going into the primary sector, and evaluating the outcomes in primary sectors to start with was more challenging than in a more controlled environment. That was one reason. The second reason was receptibility or readiness. So right now, some of the hospital services were more receptive and interested to launch the program. So you have to sell your products to an interested buyer, right? So, and that's how we decided about acute care nurse practitioner, starting with that specialty. But we absolutely, by we, I mean the whole task force, we absolutely understand the need and interest in a primary sector or public sector. And our hopes and goal is to, inshallah, one day penetrate that sooner than later. But the important thing is the pilot has to launch. So we can, unless we launch the pilot project, get some outcomes, monitor the process, evaluate the need and limitation and the strengths, then only we can replicate it into various disciplines, including public sector. So that's definitely our long-term goal.
I think these are very important responses that you've seen and generated interest, and wherever the acceptance, you are starting from that point. And I think today more than 50 audience are attending this session. Those who are from their own areas, because our people are from all over the nation. And if they like to introduce new roles, so rightly said, that they must see where are the interests, who have the soft heart to work with nurses, and this is the way they can start and initiate seeing the role modeling in Aga Khan University. Dear participants, we from the Aga Khan University School of Nursing and Midwifery are extremely grateful to you. I know many participants told us they use mobile data. That's why we are very strict with our timings. And if you have any more question, send it to SONAM, outreach, outreach.SONAM at AKU.edu. And we always send your question to those who have presented and they reply. So thank you so much, Dr. Rozeen Shivji and Dr. Rubina Barolia. This story of your journey in Pakistani nation and in our current situation was extremely important and heartening to listen. Inshallah, we will pray that till we are alive, we are going to see this role in an extremely fruitful manner. And you are sowing the seed, the future generation of nursing, and our patients and their families are going to benefit with this. Once again, thank you so much. Thanks a lot.